I'm Dr. Kiran Chokha, sports medicine, joint replacement and orthopedic surgeon. I have been practicing sports medicine, arthroscopic surgeries, joint replacement surgeries since last 11 to 12 years. I have operated more than 4 to 5,000 surgeries. Among that, I have done more than 1,000 knee replacement surgeries. Today, I'm here to talk about joint replacement surgeries. Recent advances in joint replacement surgeries are medical related, surgery related, as well as materials and methods related. Medical related, we have got nowadays PRP injections which will postpone the disease for a few years, which can be treated without the surgery. Certain situations where we can just postpone the diseases. Next comes the materials and methods. There are materials which are being sophisticated. For example, we started using ceramic material to increase the longevity of the implant, especially in the hip replacement surgeries. Regarding the knee replacement surgeries, to increase the longevity, we have got X-linked poly, that is called as highly cross-linked polyethylene, which we place in between the two metal structures in the knee replacement surgery. Then, about the surgical aspect, nowadays we have navigated knee replacement surgeries which will give a precision to the surgery and which might help us to increase the longevity of the knee replacement surgery. The last thing is nowadays we have got robotic knee replacement surgeries.